Risk of acetaminophen overdose. Acetaminophen overdose can be dangerous and potentially life-threatening. Taking more than the recommended dose or exceeding the maximum daily limit of acetaminophen can lead to liver damage and other serious health complications. Here are some key points regarding the risks of acetaminophen overdose. 1. Liver damage. The liver metabolizes acetaminophen, but when taken in excessive amounts, it can overwhelm the liver's ability to process the drug. This can result in liver toxicity and potentially lead to acute liver failure, which can be fatal. 2. Symptoms of overdose. In the initial stages, an acetaminophen overdose may not cause noticeable symptoms. However, as the toxicity progresses, symptoms such as nausea, vomiting, abdominal pain, loss of appetite, sweating, and general malaise may occur. In severe cases, it can cause jaundice, yellowing of the skin and eyes, confusion, and even coma. 3. Risk factors. Certain factors can increase the likelihood of acetaminophen overdose. These include taking higher doses than recommended, using multiple acetaminophen-containing products simultaneously, consuming alcohol while taking acetaminophen, and having pre-existing liver conditions, such as hepatitis or cirrhosis. 4. Maximum daily dosage. The maximum recommended daily dose of acetaminophen for adults is generally considered to be 4,000 milligrams mg. However, in some cases, lower limits may be advised, especially for individuals with underlying health conditions or those taking other medications that can interact with acetaminophen. 5. Prompt medical attention. If an acetaminophen overdose is suspected, it is crucial to seek immediate medical attention, even if symptoms are not yet apparent. Quick intervention can potentially prevent or minimize liver damage. Healthcare professionals may administer treatments like activated charcoal or N-acetylcysteine (NAC) to help prevent or reduce liver injury. Acetaminophen overdose stages and timeline of symptom progressions. Stage 1. The 0 to 24 hours after overdose. During the first 24 hours of an acetaminophen overdose, the person might show no symptoms at all, or show non-specific symptoms such as nausea, vomiting, sweating, anorexia, fatigue, and malaise. The dangers and severity of poisoning are not predictable at this stage because the patient might seem better after this stage. Stage 2, from 24 to 72 hours after overdose. During this time, hepatic injury begins. This is characterized by symptoms such as right upper quadrant abdominal pain, nausea and vomiting, and the liver becomes enlarged. Stage 3, from 72 to 96 hours after overdosing. This is the most critical phase, the peak of hepatotoxicity associated with severe nausea and vomiting, abdominal pain, jaundice, yellowing of the skin, confusion or altered mental status, hypoglycemia, and bleeding. Possible complications at this stage include acute liver failure, metabolic acidosis, acute kidney injury, coagulopathy, cerebral edema, and death. Stage 4, from 4 days to 2 weeks after overdosing. This is the final stage, the recovery or death phase. If the patient survives, they begin the process of recovery. They might need a liver transplant if their liver cannot fully regenerate or continue to fail. They might experience multi-organ dysfunction, requiring medical care for the rest of their lives. It is important to note that acetaminophen toxicity is highly treatable with N-acetylcysteine, NAC, if identified early, ideally within 8 hours. However, it is difficult to do so because early symptoms are unreliable and non-specific.